Hi, hope you're all well. I'm Viv and I'm the face behind Skinpharma Aesthetics in Stockton-on-Tees. Tonight, myself and Dr. Sunny Dhesi, we're continuing our journey in the use of ultrasound with practitioners from around the world, and Sunny will hopefully join me soon. Hi, Olga. Hope you're well. Tonight, myself and Sunny will be speaking to another specialist, this time from the Netherlands, Dr. Olga Liplavk, who specialises in research. She's carrying out research work looking at the use of ultrasound in aesthetics work. So I will just wait for Sunny to arrive. I won't be a second, Olga. I'll just send him an invite. He always mentions that he never receives it, but I do actually send it. I'll see if I can send it again. Honestly, Sunny, I am sending you an invite. Let's see. Oh, hi, Leonie. Nice to see you as well. Right. Let's see, Sunny. I've got your. We'll talk a little bit about what we're up to over this next few days as well. Once Olga joins us. Hi, Sunny.
Yeah, it doesn't show up when you send an invite.
I've got no idea why. So every time I send you an invite, and it goes off somewhere. I've got no idea where it ends up, unfortunately.
I think when you send it to someone else though, but because we send you a request. Do you not get the request? Yeah, is that what comes through?
You should get a request from me when I send you an invite. So it should just let you tap a button and join me without you doing anything.
Maybe that's what it is then. Okay.
No,
I always thought, because it says request to join, so maybe that's because you're sending it. Okay, maybe that's what it is. I take it back. I take it back.
Thanks for that. We've made up.
We're waiting for Dr. Olga.
Olga, yeah, she is. I will just add her. She is around somewhere. There we go. I'll send Olga an invite. Olga, if you, at the bottom of your screen, there's a button to request joining us, and if you tap that, just in case you don't get an invite from me, I think it's unfortunately happening a little bit. So once you request to join us, I'll add you into our live.
You can see that Leonie's watching. Social Media Sister is watching as well. Dr. Amy Hughes is watching, thank you, and Dr. Prada is watching as well. So yeah, we'll see you, Dr. Prada, we'll see you on Saturday. I think you might see her on Friday.
Yes, I'm actually heading down to London tomorrow morning, so I'll be there hopefully by lunchtime, and I should be meeting Leonie for training at the IET in London tomorrow. So it'll be the first time I'll hopefully meet up with Leonie.
Because the CMAT conference is taking place at the IET, and is that where Leonie's doing the training the day before as well?
Yes, tomorrow. She's spending all day tomorrow at the IET in London doing facial ultrasound training. So that'll be all day tomorrow, and then the conference, CMAT conference, starts on.
So with Leonie's training, is there a structure to it? Is it sort of a module of her training, or is this something she's going to focus on?
It covers 7 areas of the face, so I think it's looking at assessment. Hi, Olga.
Hi, guys.
Hi, Dr. Olga. How are you?
Oh, hello. Now, happy to see you.
Oh, happy to see you too.
Tonight?
Sorry, say again?
How are you doing tonight?
Oh, we're good. We're good. We were just chatting about Viv's joining Leonie tomorrow for training.
Okay.
So I was just asking what the training's going to be about. But now that you're on, we can stop talking about Leonie.
Okay, great. So,
I'll let Sunny start, Olga. He can talk to you a little bit about your background, what you're doing and how you've got to this point. And then I'll talk a little bit about your research and some of the scans that you've taken that we've talked about recently. So I'll let Sunny start, if that's okay with you.
Okay, brilliant. Sure.
So welcome, Dr. Olga, to obviously our weekly ultrasound talk. And obviously we invite people from all around the world, or Viv does very much networking, and to hear more about how other practitioners are doing things. Now, I know that you're doing a PhD at the moment, and Viv is going to talk to you about that. But just for those people watching, just give us a little bit of introduction about your training, and what got you to the stage where you're at now, where you're now doing a PhD in ultrasound.
Okay. After my medical school, I did some internal medicine, something like for 18 months, but I didn't really like the hospital life, and I missed a lot of things like creativity and really positive energy. So I started to look for something else, and I found like aesthetic medicine wonderful. And at this time we didn't have really very good education for doctors, so you you ask some colleagues to have a look at the clinic, and you learn from the colleagues. And but right now we are the only one country with real specialization for aesthetic medicine. But anyway, I was doing this work for 15 years and enjoying it. And, I considered myself like not such a bad doctor, doing nice results and working safe, till at a certain point, I've got my first vascular complication. And it was really like very, very bad. And, what happened, I worked with the 25 gauge cannula at the lateral plane, and I thought I'm working very safe, nothing wrong, but I hit the transversal artery. And then I started to do my protocol, just like standardized protocol with hyaluronidase, with very high dosage, and but it was not successful. And my patient was really in pain, and I was in panic. So I called Leonie, and she told me, just come to my clinic and, to Erasmus. And she took ultrasound, she localized the artery, and she put like 15 units of hyaluronidase, and the patient was wonderful,
Wow.
magically better. And for me personally, it was really like shock. I thought, oh my God, I'm doing this for 15 years and I even cannot help my patient. And Leonie can do it like in few minutes. And, I was ashamed, and I was really like in pain personally and professionally. So I thought it will never happen again with me, that I cannot really help my patient. So I applied immediately for the cutaneous course of Leonie and Peter. And after 3 days, I couldn't understand anything, like all these gray images.
Yes.
And but I bought my first ultrasound portable Lumify, and I just started to examine all my patients, just like all day long. And of course, it was very bad for the clinic because I was running out of the time.
Yes.
And everybody was complaining. But really, I wanted to learn it. And also at home, I molested my children, my husband, my neighbors, and I was looking for the anatomy till I started to understand it a little bit. And at a certain point, I consider myself as a very lucky person, because I had the best teacher ever. Leonie was very kind to show me, to teach me, to explain me, to involve me in her practice and to share her experience. So I started at a certain point also inject my patients with ultrasound.
Oh, wow. Okay.
And right now, all the filler treatments I do ultrasound guided.
That's a powerful story, Dr. Olga. it is, I guess it's everyone's worst fear, isn't it? It's what worries us all about complications. But, here is a really effective tool, but it takes a long time to understand it. Vascular mapping that both Viv and I have talked about is fairly straightforward, but the skill level perhaps required to, like you said, in 15 minutes, which is able to, 15 units of hyaluronidase. So, so you're now based in the Netherlands. You're based in Rotterdam as well, or are you based in?
No, I'm based in Bussum. This is a very special place next to Amsterdam.
Okay.
I'm on clinic, and I'm doing my research at Erasmus University. But also, like all the Dutch doctors, we do it in our free time.
Yes.
In our own clinics with our own patients. So, but it's like kind of a passion. So we have, and Leonie and Peter, they are my co-promoters. So they help me, they guide me a lot, and so they show me the way.
Good, good. I'll hand over to Viv because I think Viv's got some questions about the projects that you're working on. So Viv, why don't you fire away with those questions?
Yeah, thanks, Sunny. We were talking, Olga and I, last weekend. We were just discussing different topics that she's involved with. You've learned a lot from using ultrasound, and I think your research, your PhD thesis, is based on filler, how filler changes over time. Is that right, Olga?
It's exactly, you know, I'm looking what happens with the products that we are injecting. And now the ultrasound gives us the possibility to follow the filler real time, also over time. So I'm working at a few projects with HAs, with hyaluronic acids, also with PLLA, and also with toxin.
Right. I was reading just yesterday or today, I think it was, Tom DeCates. Tom DeCates, you know him well. He's in charge. Is he responsible for the body that organises training for doctors in the Netherlands? Is he responsible for one of those bodies?
Yeah, exactly. So because we have a real official specialization for the doctors to be a cosmetic doctor, Tom, he's in charge of this, you know, organization to train.
Right. And after you've been working for this length of time, 15, 16 years, what made you look into the need for research? Why did you want to do work involving high hyaluronic acid and fillers and how fillers change? What was it about that wanted you to research that topic?
You know, guys, it's a strange thing. I think for every cosmetic doctor, we have the same experience. So, you know, we know about hyaluronic acid, and the industry tells us that the product will stay 12 months or 18 months. But at a certain point, you know, we see our patients after 5 years, and you still see something and you still feel something. You know, how come? Even my own experience, you know, I have been injected 15 years ago with Duoderm 2, very light hyaluronic acid, and I still have it under my eye, you know, it doesn't go away. I cannot remove it with hyaluronidase, you know, how come? These kinds of strange things. And of course, you know, at a certain point, if you work so long at the field, so you want to do something very specific, something inspiring, just, you know, to keep on running, to keep on going, to like your work, and, you know, to do the better care for your patients. So that's why, you know, I was lucky because Leonie involved me also in few of her projects. And I was very enthusiastic to do it also. And so I bought also a very big machine, a big Siemens, the real stuff, you know, for my practice. And it started to be very interesting to do this kind of things, you know,
So, sorry, Viv, I was going to ask, so, I mean, that's a fascinating topic, Dr. Olga. So, because from our point of view, and I'm sure, you know, you've been doing a bit longer than I have, and Viv, I can't remember, you've been now practicing how long?
17, 18 years.
And you, Viv, how long have you been practicing for?
6 to 7 years.
Yeah, so me and Viv are very similar. So, you know, you got the marshness. When you're first learning, I think Juvederm, Allergan is the most popular, or whatever you're trained with. Then you kind of get, I wouldn't say seduced by Allergan, but there's that element of oh, Juvederm is there. Then you find different hyaluronic acids. So as part of your research, what is it that you're particularly investigating about? Is it different versions of hyaluronic acid from different brands, or is it more based on hyaluronic acid itself?
So I'm looking actually at hyaluronic acid. So we don't, I don't call the names, but anyway, so maybe Viv can show a few
Yes,
images.
please, that would be good shout. Yeah.
Actually, what I'm doing, I'm injecting hyaluronic acid at the different planes and the different levels on the face. I inject it in deep fat compartments, in a deep medial cheek fat, then under zygomaticus major muscle, and subcutaneous. And maybe we can show us few images. For instance, I inject in the deep fat compartments, then measure the volume of the filler.
Brilliant. Yeah.
Follow it like 3, 6, 12, and 18 months.
Yeah. When you're just out of interest, and I'm sure maybe other people are thinking about, you can measure the volume of the filler that you're putting in. Obviously, you know how much volume you're putting in.
Yeah.
From the ultrasound, are you able to calculate displacement and then potentially projection, or how much projection that filler is creating in?
Not really. No. I measure the volume of the pocket of the hyaluronic.
Okay.
So you do the double image.
Yes.
You can measure the length, the depth, and this kind of
stuff. The length and depth. Okay. That's good. Yeah.
And what's fascinating me now, I'm doing my follow-up of 12 months with all these patients. You know, the filler is still there. And I don't see very big difference in volume change of the filler. You know, you cannot measure very exactly the volumes, but you can see if it's maybe the half, or if it was very big and now it's very small. I don't see a lot of changes in the volume. And you can see also the filler, the pocket, very good. And there are some morphological changes. So, for instance, when you just inject the HA, it's quite anechoic or hypoechoic. And, you know, after 12 months, we see some changes. It starts to get more like heterogeneous with some white, you know, shadows, spots, maybe because of the tissue integration. And my colleagues, very experienced colleagues, they rating the pockets according to the certain nomenclature. And it was developed by Leonie and our colleague Wartzman from Chile. So this is the way we do the follow-up. And then at a certain point, you know, after 18 months, I'm very curious if I can still see the filler, because I inject subcutaneous on the periost and also in the deep fat compartments. But after 12 months, you can see it wonderfully, and there is not a lot of change.
Do you assess for the change in the patient as well? Do you see if they, do you look at, would you ever look at it from two aspects? One, if you can see an aesthetic change in the patient, obviously the filler looks like it's degraded, and do you get the patient's view as well in regards to that? Is that something that you're recording as well as part of the research?
Not really. It's we are not based on patient experience, but of course I ask my patients, what do you find? Are you still happy? And what I notice that you know, when you inject in a deep fat compartment, the result stays quite long. So you inject, of course, under the muscle, under the zygomatical major, so there is not so much movement. The filler stays very stable, and people are quite happy.
They're still happy. That's really interesting. Really interesting.
It was. I was just going to say, you've got to do 5 subtopics within your PhD thesis. Is that right, Olga?
Exactly. Yeah.
Yeah. What I've got then is a few examples of the work that you've done or the work you're doing. Mm-hmm. So the first example is actually toxin in the masseter. Do you want to just talk to us a little bit about this scan, Olga?
Yeah, it's fun. It's also one of my projects. So what I'm looking at, so when we inject the toxin in the muscle, in the masseter muscle, what happens with the muscle? Do we see some quality and quantity changes of the muscle? And if we can see of these changes are also reversible. Because this picture, what you see on the screen, so you see the masseter muscle and also some whitish stuff, you know, at the bottom, down on the bone. And these are the changes of the muscle after 3 months. Wow. So we can still see it. And what do we see? Is it some kind of atrophy, or is it... do we see some fat tissue, you know? So we still don't know, but we try to do the follow-up and to see if there are some reversible changes, and obviously the quality and quantity changes of the muscle.
Yeah, this has got a lot of implication for work in the future, the research you're doing, Olga, because it may well affect drug companies. It may well affect how treatments are carried out for patients as well. So you're very quiet, but I think if you were anything like Tom Cates, he'd be shouting and screaming at people, telling them, you need to do science research properly. You can't just make up results. You have to look at the actual evidence and base your information on research evidence. So I think what you're doing is fantastic, and I think it's got a lot of implications for what happens in the future.
Exactly, you know, so we're doing something like, you know, good, safe stuff, and we work also very safe, but what's the future? We still don't know.
Yeah.
Not with toxins, so, and not, of course, not with the fillers. We still don't know.
I've got another example of your work, Olga. This is deep medial cheek fat, or orange, as you call it, I think.
No, this is deep medial, exactly. It's not the orange. The orange is another.
Oh, sorry.
Show it later.
It's the other one.
But this image, I think it's the image after 12 months.
I'll show the after image. There's the 12-month image.
Okay, this is 12-month image, and the first image you showed, it was the image just right after injection.
Yeah.
So you don't see real big difference, you know? And we will expect, like, after 12 months, the pocket will be very small, it will shrink or disappear or diluted, or it will be very different morphology, but still it's quite the same.
Olga, were these scans done with your, not your, how are these scans done? With your, I think, more advanced?
Yes, I do it with my Siemens machine. So these are volume images. So I can calculate also the volume.
All right, okay.
And the same I do also with subcutaneous injections. And maybe we can show it also. Yeah. Because also this is after the injection, you see anechoic pockets in subcutaneous tissue, and after 6 months it's almost the same.
Yeah, I've actually got, this is another one. This was 6 months of the superficial. That's the one. So that's initially, that's after 6 months.
So you can still see the pockets very clearly, but yeah.
Amazing. Well, one more piece of work that you're looking at. This is nodule formation within fascia. You can tell us about this, Olga.
This is also nodule formation. What happened? So when we inject in zygoma, so when we inject with cannula or with a needle, so I learned it anyway. You know, when you inject, you feel something very hard, and it's a bone. You know, it's like periost. But what we don't know, the smash can be also very, very hard, also for your needle and also for your cannula. So you think you inject periost, but actually you inject in a fascia. And the clinical picture, of course, bumps and, you know, like very nasty picture. People are not happy about it. But fortunately, you can dissolve it easy with hyaluronidase, and you know, if you use ultrasound, you can really inject in the pocket and the problem will be solved very quick. I can tell you, this is my patient. I inject.
Yeah. You're brave to actually say that, because a lot of
sound, you know.
Yeah. You're very brave to mention the fact that it's your patient and your work. It shows that this can happen to anybody. It's not just certain people it affects. It affects everybody.
It affects everybody, and even me, you know, I use ultrasound, and you know, what we see, it's also about the backflow, especially when you use cannula, you can get this kind of bumps and noduling.
Yeah.
Definitely, definitely.
I've got this is the orange. I was looking forward to this orange fat, because it was Leonie's idea of calling it orange, wasn't it, Olga?
Yeah, she invented. I think she invented the term. Anyway, I learned it from her. She calls it orange, but this is superficial cheek pad. So this is one of our projects with Leonie. So we inject PLLA, also ultrasound guided, and you can see also the hyperechoic white dots, you know, this is typical for PLLA. And the same images we do when we inject on the periost under the zygomatical major muscle. So, and you know, it's so nice to do these treatments. These are very easy, quick treatments with wonderful results. Because, you know, when I started to do cosmetic work, I learned to inject a sculpture of PLLA, like with needle, with a lot of injections. It was painful and it was nasty. But now when we use ultrasound guided injections, patients, they don't have any pain.
Really?
Instant effect, and you just use 2 injection spots and you use your cannula. Wonderful. And this is this white mass, what you see on the periost, this is PLLA.
Oh wow, okay.
And above part of zygomaticus major, and it gives very beautiful instant effect, because you lift the cheek, you lift the zygomatical major muscle. People are really happy.
Amazing. It's just Sculptra, that's the brand name for PLLA. There's other brands available, but it's not something I use myself. Do you use PLLA products, Sunny, at all?
Not PLLA. I've been using something recently called polynucleotides, which are more biorevitalizers. Obviously, I think that's the only remit outside of things like hyaluronic acid, like Profilo or Redensity 1. But no, I haven't really used Sculptra. I guess when we've been doing it for 15 years, maybe then we'll be able to. This will make you laugh, Dr. Olga. Someone's already commented and said, I think, when did you start injecting? Because you look so young. And so you've had a few compliments about how young you look. Beautiful and natural. There you go.
So we are great doctors in Netherlands. We help each other very good.
Let's keep looking young. Yes, definitely.
It's really nice being able to speak to Olga about the work that she does. Over time, how long do you think, I was asking you this last week, Olga, how long do you think your research will take place over? How long a period of time will it cover? So
definitely a few years, because, you know, like the study what we are doing, it's quite long, you know. I need at least 18 months for collecting of my data, and after that, of course, you have to write, you have to do your statistics, and because we have a few projects going on, and of course I have my own practice, very busy, so I do it in my free time that I don't have, you know. So it will take quite some time, but we will be there, you know. And I tell you guys, I'm really so lucky with Leonie and Peter. They really help me, and they have so much experience. And
will you release any results? Will you release any sort of publications as case studies or things that you're finding as you go along? Because obviously, like Viv said, this has potential for a massive impact in how we practice. Will you be doing that, or will you leave it all to the end of the time of your PhD?
Guys, really, I don't know how it works in, you know, this kind of stuff. So I have to consult my, you know,
the mentors. I think you can release case studies. I think if you come across some interesting, I think you can release it as case studies, and obviously then it leads into publishing. But I'll let. Obviously, I've not ever published any. I've got one. I think I've got one article to my name. This is in ophthalmology. So yeah, what do I know?
But
you've done. It's really nice talking to you about your work, Olga. It's fantastic. Myself and Sunny were invited by Leonie over to Erasmus. We haven't had time this year to go and visit her, but it'd be fantastic to meet you, Leonie, Peter, Tom, everyone who works at Erasmus and does such fantastic work, informing everyone about the whole different aspects of aesthetic medicine. We'd love to see you. Are you likely to be there at Erasmus doing your work?
For sure, I will be there, guys, to meet you and do some work together. It will be really, really inspiring.
Thanks very much.
I'm just going to say, look in the comments. We've just had. I follow Glow Day. Glow Day Pro is a very very strong advocate. So Hannah, I think, has joined us. Very strong advocate for medical aesthetics. Very their software system, and then they've just joined as well. So we've been joined by a lot of people today. And I think, just as a summary, but I'll let Viv have the last word because he's hosting. But really, it's fascinating, and it's so fascinating, Olga. You're committing your time, and it's just a reflection of aesthetics. I mean, I think in the Netherlands, you said you're very lucky that you've got a standardized and recognition for medical aesthetics.
Yes.
So it's something that we aspire to, which is why we're doing this every week, to just again spread the word that aesthetics should be medically based. Healthcare professionals should be doing it. So Viv, on that note, I'll let you have the last word.
Thanks very much. Just you wanted to thank you, Olga, for taking time out, and it's like 10 o'clock in the Netherlands now, so you're going to be tired, I'm sure, but sorry for keeping you up all this time. But in terms of ultrasound, myself and Sunny, we've been talking every week about how it's helping us, how it helps other people, how it can make the work we do much safer, and how we learn from it as well. We learn more about dynamic tissue movement. Leonie talks a lot about that, and it's interesting to see what you can learn just by using ultrasound in the face. What would you say to a practitioner perhaps who's been working for 10, 15 years, has never had a problem, and they think, ultrasound, yeah, it's a gimmick, we don't need it. I've never caused a problem, and I don't expect I ever will. What would you say to them based on your own experience?
So, guys, one thing, the doctor who says, I never have a complication, the doctor doesn't make enough flying hours, so it will come anyway. If you work full time, it will come for sure. And, I think it's very, very nice, very, very special to have ultrasound in your practice. For instance, Dutch patients, they are very, very good educated, and they come to you and they tell, for instance, I never want to be treated without ultrasound anymore. So it gives you the possibility to give better results, to work safe. And also at a certain point, you can even earn more money with the machine because you need less product. You have superior results for your patients. And, people know that it's much better and it's much safer. So it's really worth the trouble to invest your time and invest your money in this ultrasound project. And of course, it doesn't give you 100% guarantee. Even, the best people can make mistakes, but anyway, you can help your patient and you can set the better results. So guys, do it.
Thanks very much, Olga. It's very kind of you. I was just going to finish off. Tomorrow I'm off to London, and I'll hopefully be meeting Leonie in London, and I'll be taking part in an ultrasound training course over the day. So what would you say about Leonie? She's watching now. What are your views of the work Leonie does?
Yeah, I think she's, really like a pioneer in this field, and she's very, very creative. She's very inspiring. She's full of different ideas, and I think, and she really loves to share her knowledge and to help doctors, to help colleagues to learn it also. I think it's a very inspiring colleague and person. I love her.
Thanks very much. We'll be at the CMAC conference, myself and Sunny, which starts on Saturday, finishes Sunday afternoon. Leonie is heading the ultrasound part of the whole conference. There's going to be lots of talk about problems, complications, and the conference is all to do with aesthetic complications. And there's practitioners from all around the world flying in for this two-day conference. So it'll be a fantastic place that we'll be meeting these specialists, a lot of whom we've gone through with lives over the last few months. So it'll be interesting meeting them face to face. Really, one more thing, we've got, we'll be doing hopefully lives from London over the next few days once we're there, but we've also got Dr. Mobin Master, who's a specialist radiologist in Australia. who has carried out research using MRI scanning of facial fillers. So we'll be talking to him on Sunday the 27th at 10 a.m. purely because he's in Australia and it's about an 11-hour time difference. So that's it. We will say a big thank you for joining us, Olga. We hope to catch you hopefully next year at Erasmus. We'll come and visit you, Leonie, Peter, and everyone else.
Sure. Thank you very much for inviting me. It was a pleasure to talk to you guys.
Thank you. Thank you. Thanks for hosting.
Oh, no problem. Thanks very much, and we'll catch you again soon. Thanks, Sunny, and thanks, Olga.
Bye-bye.
Thanks. Bye.
See you.